Thank you, Chris. It's an honor to be here. I wish I was able to attend in person, but I'm grateful for the support of these amazing women as I focus on my family. My name is Heather Javaherian. I am the program director at Loma Linda University. So I want to begin just sharing a little bit about my journey. Began in service in 1999. I was living in my small town in Pennsylvania and wanted to give back. And so I went ahead and completed a domestic violence advocacy training. And then I had moved to Ohio and began my doctoral studies at Creighton and started to integrate the work of domestic violence into my capstone. And it began with a question. And so I was wondering, what is the role of occupational therapy in domestic violence? And so that was a qualitative research study. And as I delved into that in the literature, I was really looking at all of the work of Chris and her colleagues. That was the foundation from which I could then move from. And so that qualitative research study led me to have opportunities to incorporate master's students. And then as I learned and observed and participated in the shelter experience, I said, oh, we have so many opportunities for fieldwork. So I spoke with our academic fieldwork coordinator and said, I need to have level 1 students here. And so then I was bringing students to the shelter. And then I remember one day I was reading my OT practice article, saw the call for RA motions, and thought, I really need to advocate. This is a national problem. This is a global problem. We really need to have a statement about domestic violence because our patients, whether we know it or not, some of them have experienced domestic violence. And are we missing it? How are we addressing it? And so I submitted that motion, and then soon I found myself working with Robin Underwood and Janet Delaney from AOTA to draft that first statement, which has been revised since then. And then I was able to publish that study I began in my doctoral work in 2007 about rebuilding lives for survivors of domestic violence. So what's happening in IPV and occupational therapy? So we've heard of Chris's work, and then we also have Dr. Gutman and colleagues who did a quasi-experimental design. And then, more recently, there was the work of Waldman and Weintraub, who did pre-test, post-test, two-group control study design, focusing on mother-child interactions. And then I did a study that looked at over 60 evaluations, really trying to publish those findings to show that there is indeed a direct relationship of the needs that these women are identifying in our practice framework. So we need to build the evidence though, because when you look at all the different studies that have been done, you'll find there's what is best practice? So there's individual and group therapy sessions. They range from 1 week to several times a week. The length of the interventions, both individually and group-wise, range from 2 to 10 weeks. And really, we have a lot of limited outcomes, so we need stronger research designs. And then our interventions focus on various life skills. So there's a lot of opportunity for occupational therapy to make an impact here. So as I continue my journey thinking about domestic violence or intimate partner violence, I really felt like it captured these areas of service, impacting our community, then bringing in fieldwork students, then asking questions. Well, is the program we're running in fieldwork working? Or is this, program I just, learned about, how can I implement that? How is it as far as outcomes at the shelter I'm at? And then taking that to say, how can I impact our curriculum? So now here, at Loma Linda, we have content on domestic violence. We've actually done interprofessional education opportunities on domestic violence, working with the School of Medicine, School of Pharmacy, social work, to talk about domestic violence from an interprofessional standpoint. So I'm trying to make a small difference. This just kind of summarizes a little bit of my work. The exploratory study in 2006, I did receive a small grant to help fund that. And then I have a couple unpublished intervention studies looking at infant massage with survivors. I received a small grant of $1,500 to, and try to use that to fund the supplies. It didn't really cover my training to become certified, but it covered some of the supplies that I needed to implement at the shelter. But we had a very small sample size. It was unpublished. 2014, I did a study looking at the health profiles of survivors of intimate partner violence who are living at a shelter. And it was a great study. I really remember doing this and enjoying it because it was eye-opening to think that they're struggling. Where are they going to live? How are they going to have food on the table? Who's going to watch their children? Maybe they already have a CPS case. How are they going to have a job, but yet be a provider for their child or their children? And meanwhile, to realize they're struggling with obesity, they're struggling with GI problems, they're struggling with pain, all of these health conditions that are being impacted as well, which we know is supported in the ACE literature. And then I did another study where I implemented a modified complete health improvement program, CHIP. Maybe a few of you are familiar with that. There's some publications nationally, internationally with that program. Again, another fun study to do. I had to modify it because the CHIP program has certain nutritional guidelines, certain exercise guidelines, and I was implementing it in a shelter, domestic violence shelter in San Bernardino County. And so I had to really think about, well, we have donated food here, so how can I modify this to make things healthier for them? And it was a wonderful experience, but again, a very small sample size. And I received a grant for $2,200 from the California Foundation of Occupational Therapy. So a lot of challenges were really the limited funding. My time really wasn't covered. These were just added in, and then the small sample sizes. But more recently, actually currently, I'm doing an online resiliency and mindfulness program with survivors, and it's running 3 times a week for 4 weeks. It's a very scripted experience. We open with an introduction. We provide an education piece. Then we engage in the experience, and then we have a closure. And we find that that's a really nice flow because we don't want to just have the experience. We really want to educate the participants about how it does impact our brain, the importance of practicing, how that mindfulness can impact our resiliency factors. So that's been a great experience. However, it's a small sample size. So, for me to get this published is going to take probably a couple years of data collection. And I have no funding right now for this. And then the work with these women here has inspired me to, make some bigger strides. And so I have contacted some colleagues at the Loma Linda School of Behavioral Health, and we are in the process of drafting a proposal to do an intervention study using the community resilience model. We're really excited about this, but we'll need to have more CRIM training. I've had just a 2-day training, so it would be best if I had the full training. We need funding for that. And then we also are thinking about exploring the use of more biologics to look at outcomes. So some challenges: accessing the population and completing the training. I found in my experience that it was necessary for me to do the local or the state DV advocacy training because then it showed the organization that I wasn't just coming in as a researcher, that I really was coming in because I cared about this problem, these women, this problem in our United States. And then it takes time, though, to build those connections, to establish trust with that organization. So you can't just plan this to walk into a facility and go. And then one needs to understand the culture of the organization. Their goal is to protect the residents. That's their first priority. And then how does the organization view trauma? Do they understand trauma-informed care? Do they embrace it? Other organizational challenges are how do staff support trauma-informed care and interventions? And then what is the resiliency of the staff? How does their resiliency or lack of resiliency impact the functioning of the larger system or organization? Does the organization value research and understand the importance of doing research? And then the funding, do we have funds? Do they have funds to support us coming in and doing programming and then, of course, studying for outcomes? We need to do these more long-term studies so that we can obtain a larger sample size, and then to have mentoring support. And once again, I'm so grateful to have been connected to these women because I know that these ideas, these connections that we're talking about today aren't going to stop here today, that they're going to continue on so that we can really make a difference. So thank you all so much. Chris, I'm going to turn it back over to you. Thank you.